Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for 1 contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no conflicts of interest. To receive contact hours for this CPD session, participants are required to attend the webinar and complete the evaluation form, which will be emailed to all attendees approximately 1 week after the webinar. This webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. We'd like to thank our speaker today for sharing her expertise with us. Our speaker today is Susan Hassmiller. Susan is serving as the Senior Scholar in Residence and Senior Advisor to the President on Nursing at the National Academy of Medicine from January 2019 through the end of September 2021. In this role, she serves as a key member of the leadership team for the report, The Future of Nursing 2020 through 2030, Charting a Path to Achieve Health Equity, released in May 2021. She is also the Robert Wood Johnson Foundation Senior Advisor for Nursing, and in partnership with AARP, she directs the Foundation's Future of Nursing campaign for action. This national initiative advances the recommendations of the Institute of Medicine report, The Future of Nursing, Leading Change, Advancing Health. Hassmiller served as the report's study director. Susan has worked in public health settings at the local, state, and national levels, including the Health Resources and Services Administration. She taught community health nursing at the University of Nebraska and George Mason University. Susan is an elected member of the National Academy of Medicine, a fellow in the American Academy of Nursing, and sits on other advisory councils, committees, and boards, including the Hackensack Meridian Health System, United Health, Carrier Clinic, Nurses Everywhere, and the American Red Cross. She is a recipient of many awards and 4 honorary doctorates, but most notably the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. We are so grateful to have you today, Susan. Please take it away.
Thank you so much. Thank you. Linda and Megan, I'm delighted to be with you today, and I'd like to thank all of you for taking the time to be here, no matter whether it's morning, afternoon, or evening where you are. Nurses are going through a lot right now, all over the globe, not just here in the United States, and I'm grateful to you for taking the time for this webinar. I'd like to especially thank any international nurses who set their alarm clock to join the webinar in the middle of your night. I am so honored if you are doing that, believe me. And I have no conflicts of interest. Okay, so let's see. Let me just go down here. Learning objectives. Slide shows 3 learning objectives to identify the 4 key takeaways of the National Academy of Medicine report. The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, to explain why it's necessary to adequately acknowledge, confront, and dismantle all systems of structural racism, including within nursing, to advance health equity, and describe 2 actions that you can take to advance the report recommendations. So I hope you'll be thinking about that while I am speaking. Okay, slide 5, the pandemic's toll, and I realize I need to let my colleagues at Sigma know when to change the slide, so I will do that now. I am on the slides listed as the pandemic's toll. It's been a difficult 18 months, and we're now experiencing a fourth wave with the Delta variant. Many of you are dealing with the pandemic, staffing shortages, and stress and anxiety. The United States faces a divided country. I'm sure that is no surprise to any of you, and many countries throughout the world who do not yet have widespread access to the vaccine. In far too many places, we have a long way to travel to achieve justice on these things for everyone. Many of you are exhausted. Many of you are proud to be a nurse. I'm proud to be a nurse, of course. You've done and you continue to do things during this past year that no one else can do. I'm hopeful that together the nursing community and leaders in government and healthcare can coalesce around and implement long-term sustainable solutions to make nurse well-being the norm. We need to give you tools that you need to feel better physically, mentally, and spiritually. And I'm grateful that Sigma is providing some of those tools through its Find Your Forward initiative. We can't continue with things as they are. I'm here to talk to you today about a new report that launched in May called The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. The report is intended to serve as a compass to where the profession needs to head in the next decade, and I think it's another reason to give us all hope. One of the report's key takeaways is the need to truly support nurses. We need to finally find long-term solutions to address the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, poor physical and mental health. One of the main imperatives for everyone, policymakers, community members, and healthcare administrators alike, from an ethical, advocacy, and policy standpoint in the next decade, will be to improve nurse well-being so that nurses will be able to continue to care for patients, families, and communities in the way they want to care for them. This is the future of nursing. I want you to know that the committee released this report sees you, they hear you, and they want to fully support you so that you can do what you envisioned when you became a nurse to provide the best care possible to people, families, and communities. For those of you who are online, all of you, I would love to hear your thoughts in the chat as we go along, and I know those will be read to me at the end. So you can put your thoughts in the question format as was discussed earlier. If you've had one word to describe the last year, what would it be? Just one word, put that in the question form. If you had one word to describe your hope for the future, what would it be? So I look forward to hearing from you. Next slide, slide 6. This report is the second major report released by the National Academy of Medicine on the future of nursing. The first report, and I hope all of you recognize the cover of that first report, reconceptualized the role of nurses in transforming the healthcare system. The nursing community, including Sigma, and many of you mobilized to strengthen nursing education, advance practice, promote leadership, and increase workforce diversity. Nurses throughout the world advanced the recommendations in their own countries, in their own ways. Together, we built the capacity of the nursing workforce to expand high-quality care to more people. This new report builds on the gains that we have made, and we're still building those capacities, right? Okay, next slide, slide 7. As the nursing field built its capacity, we started to ask, to what end? Why are we building all this capacity? To what end? We knew that the United States spends more than $3.5 trillion per year on healthcare, but underperforms on nearly every single metric compared to a lot of your countries. I will tell you that. It's very sad. The Commonwealth Fund released a report last month showing that the United States ranks last among other high-income nations when it comes to equity to care, access to care, administrative efficiencies, and healthcare outcomes. Next slide. Life expectancy, infant mortality, and maternal mortality are all worse in the United States compared with other developed nations. Disparities in healthcare access and outcomes related to race, income, geography, and other social and environmental factors are also common. Next slide. The report. But we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of the healthcare workforce. They work in a range of settings, and they're often the first and most frequent healthcare contact with individuals, families, and communities. In 2019, my foundation, the Robert Wood Johnson Foundation, asked the National Academy of Medicine to chart a path for the nursing profession to reduce health inequities and improve the health and well-being of this nation. NAM planned to release a consensus report in 2020, but guess what? You know what happened. The pandemic happened, followed by ongoing calls in this country, and I'm sure many of your countries as well, for racial justice. And we realized that the only way for this report to be relevant was to delay its release to incorporate the pandemic, the lessons of the pandemic, the devastating toll it's taken on nurses, and the ever-growing calls for racial justice. The report is being released during a critical time in our nation's history and in nursing, when it's clear we must dismantle structural and interpersonal racism to eliminate inequities. Nursing needs to be at the forefront of creating a more fair and just world, and we need policy reform to unleash our potential. The report's vision is audacious. The achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. The report notes that to achieve the committee's vision, a significant investment in broader and deeper development of nurse leaders will be needed. That's where Sigma comes in. My hope is that Sigma will continue to help to develop these leaders so that more nurses will be poised to advance health equity for the future. Next slide. And while the report recommendations are targeted in the United States, nursing leaders throughout the world are taking interest in this report, as they did the first report. This map shows PDF downloads of the report by country. Canada, China, Australia, and India lead the number of downloads as of August 25th, including, of course, the United States. Next slide, please. Slide 11. Achieving health equity is the most salient issue of our time, and this is nursing's time to help lead the charge. Our country has long failed to give everyone a fair and just opportunity for health. Health is greatly influenced by access to jobs that pay a living wage, safe housing, reliable transportation, walkable neighborhoods, good schools, fresh foods, and adequate green spaces. Factors like our race and ethnicity, income levels, sexual orientation, disabilities, and the conditions where we live predict whether we are more likely to suffer from preventable, costly medical conditions and live shorter lives. Next slide, please. So this is a slide from New York City, and it's about redlining. You may have heard about that, something that has been common in our country. Compared to white people, Black, Indigenous, and Latino individuals in the United States are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work in various, often reinforcing ways to perpetuate racial group inequity. Redlining, for example, was used throughout the country in the 1930s to keep Black people restricted to certain areas of a community that lacked social and economic resources. This slide shows a map of New York City with the yellow areas defined as definitely declining and the red areas as hazardous. Banks were encouraged not to support loans for home ownership in these areas. The map was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. Next slide, please. These structural inequities and racism experienced by people of color on a daily basis leads to stress, poor physical and mental health, and the advent of chronic conditions sooner than among white people. These factors also put Black and brown people at higher risk for COVID. Next slide, please. Low-income individuals and people of color are more likely to live in crowded housing, rely on public transportation, and be essential workers. They are also more likely to lack health insurance and less likely to be able to, I realize, lack health insurance is something unique to our country. This has made it difficult and often nearly impossible to follow recommended social distancing guidelines during the pandemic and puts them at higher risk of getting sick or dying from COVID. Next slide. The brutal killings in the United States last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by armed white men while he was out for a jog, and the unconscionable long list of Black and Latino victims who preceded them and came after them, as well as the 6,600 reports of hate incidents against Asian Americans and Pacific Islanders this past year, underscore the need to adequately acknowledge, confront, and dismantle all systems of structural racism, including within our great profession. We must all commit to a more just future. This, my friends and colleagues, is the future of nursing. Next slide. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do the work, value their contributions, prepare nurses to tackle and understand health equity, and fully support nurses. The need to dismantle structural racism and diversify the nursing workforce is woven throughout. And I'll discuss each of these takeaways now. Next slide. Many people in our country can't access health care because they lack insurance, something unique to our country. I realize that. Also, the ability to pay in clinics or providers in their geographic area, particularly in rural and urban areas. Nurses can help to bridge the gap in access to care. About 70 to 80% of advanced practice RNs work in primary care. The nurse practitioner field has grown tremendously, while the number of physicians going into primary care has remained stagnant or declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to the care provided by physicians. They are less expensive to employ than physicians and more likely to care for vulnerable populations, including those in rural areas. However, their ability to fully practice is limited by state and federal laws in this country, institutional barriers, and restrictive health system policies. And I know that's true globally. And these policies that prohibit them from working to the full extent of their education and training. Next slide. The report calls for all organizations to enable all nurses to practice to the full extent of their education and training by removing regulatory and public and private payment limitations and restrictive policies and practices. This recommendation continues the work of the first report, but it discusses in more detail now lifting barriers that prevent all nurses, not just nurse practitioners, but all nurses, RNs, licensed practical nurses, from practicing to the top of their education and training. These range from restrictions on providing telehealth services and workplace policies that prevent nurses from providing the best possible care. Next slide, please. Takeaway 2. The second takeaway pertains to the U.S. health system. The report calls for valuing nurses' contributions, including those of school nurses and public health nurses. The current U.S. payment systems are not designed to pay for services that address the social and economic drivers of health and advance health equity. They often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients, and when they support team-based care, improved communication between providers and patients, and proven interventions and strategies that can reduce health equity. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private systems should be intentionally designed to support and incentivize healthcare and public health organizations to enable nurses to perform their roles. Next slide, please. We need to do a much better job of educating nursing students so that they are prepared to promote health equity. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technology, and collaborate with other professions and sectors. That's a really important point of this new report, is multi-sector collaboration and adapting to a changing policy environment. Collaborating with partners outside of healthcare will be particularly important in the next decade, including organizations focused on housing, transportation, social isolation, and food insecurity. Next slide. This report identifies 8 skills and competencies that all nurse leaders need to advance health equity. Sigma and nursing leaders in academia and practice could help nurse leaders to develop and expand these leadership competencies for nurses. I want to single out the need for nurse leaders who are comfortable, again, leading multi-sector partnerships, including with organizations outside of the healthcare sphere, such as community-based organizations that deal with food insecurity, transportation, housing, and social isolation. Next slide. Developing a more diverse nursing workforce will be key to advancing health equity. The report calls on the nursing field to address systemic racism and bias within nursing and prioritizes diversity and cultural humility. Defined by flexibility, a lifelong approach to learning about diversity, and a recognition of the role of individual bias and systemic power in healthcare interactions. For too long, the nursing profession has identified as being caring and maintaining an identity of color blindness. Nothing wrong with maintaining a caring persona, but the color blindness is something that I know that I was so proud of when I graduated from nursing school. But I know now that it was admirable at the time in its intent, but it was wrong long term. And unfortunately made us blind to the structural racism that has long existed in our profession. We need to acknowledge and confront structural and interpersonal racism in nursing so that we can address the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, the nursing field remains approximately, in this country, 80% white, even though white people make up 60% of the US population. The gap widens further for nurses in leadership positions, and this is something that I would imagine is true in all of your countries, including in academia, with about 90% of all the nursing leaders in this country coming from white backgrounds. Nursing students and faculty must reflect the diversity of the population and break down barriers of structural racism present in today's nursing education, including in the curricula, institutional policies, and structures and the formal and informal distribution of resources and power. All nurses need to communicate and connect with people of different backgrounds and be self-reflective about how their own beliefs and biases may affect the care that they provide. Diversifying and strengthening the student body and eventually the nursing workforce requires cultivating an inclusive environment, recruiting and admitting a diverse group of students, and providing students with support and addressing barriers to their success throughout their academic career and on into their practice life. Sigma offers mentoring to emerging nursing leaders. It would be fantastic to expand your mentoring program to prioritize more nurses from underrepresented backgrounds. Next slide, please. Right now, content about the social and economic drivers of health inequities, and population health are not well integrated into undergraduate and graduate education. Schools of nursing need to integrate these concepts and competencies throughout the coursework. For nursing students, this means that you should start to see more classes like population health. Schools should also expand community learning opportunities, substantive education in the community, such as schools, workplaces, home health care, public health clinics, and telework settings. Allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals. We need to also increase the number of PhD nursing graduates focused on health equity. Next slide, please. The fourth takeaway is to fully support nurses. Nurses need to feel healthy and well. Wouldn't you agree with that? And well supported in their workplaces to effectively care for people and to advance health equity. But the pandemic has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses worked in understaffed settings. They were overworked and burned out. Many worried about bullying and violence in the workplace. Many also cared for children or elderly relatives outside of work. These stresses have been exacerbated by COVID. It's a totally out of control situation. More than 12,000 nurses participated in a December 2020 survey conducted by the American Nurses Foundation. Most share that they are currently experiencing a higher likelihood of depression, anxiety, and distress from when they were surveyed in spring of 2020. During the spring administration of the survey, 50% of nurses indicated they were overwhelmed. These feelings have intensified as nurses indicated in the recent survey that 72% of them felt exhausted. And I will tell you, my friends and colleagues, it's probably much higher than that now, very sadly. Next slide, please. Fully supporting nurses also means addressing and eliminating racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces. Our workplaces should reflect the patient population that we serve, and everyone should practice cultural humility and be aware of their biases. Implicit and explicit bias training and cultural practices accepted and championed by leaders within the institutions where nurses work will be critical. Our workplaces need to recruit, retain, and promote nurses from underrepresented backgrounds. We need to advance nurses of color, as I said previously, to leadership positions where they are sorely underrepresented. Next slide, please. What the workforce has been through is unjust and unsustainable. We need to tackle the systems, structures, and policies that create workplace hazards and stresses that lead to burnout, fatigue, and poor physical and mental health among the workforce. This report includes a number of recommendations to fully support nurses. The main one is that by 2021, nursing education programs, employers, nursing leaders, licensing boards, and nursing organizations should all initiate the implementation of structures, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they now take on new roles to also promote health equity. I'm thrilled that Sigma has developed free resources to nurse well-being through the Find Your Forward initiative, including micro-learning recordings, podcasts, PDF resources. Sigma also offers non-recorded sharing sessions to offer a safe space for nurses around the world to get together, view a micro-learning session, and break out into small groups to discuss feelings, emotions, thoughts, and observations. Good for you, Sigma. I want to emphasize, though, that we need structural and cultural changes to fully support nurses. There's only so much that individuals can do. Next slide, please. The report calls on all the nursing organizations to work together to create a shared agenda to achieve health equity. They should identify priorities for education, practice, and policy, and to develop mechanisms for leveraging existing nursing expertise and resources. We'll be much more successful if everyone is rowing in the same direction. These I have on the slide are organizations particularly unique to the United States, and I'm sure you have your own versions of them in your country. Next slide, please. Slide 28. The report offers many ways for individual nurses to get involved in advancing nursing equity. Nurse educators, you can see some ideas on this slide, including developing competencies to advance health equity, initiating dialogue about racism and inequities in your classroom, and mentoring and sponsoring students from underrepresented groups in nursing. Be ambitious about what is possible. The report contains exciting examples of what a partnership with a nursing school can be. Graduate students, for example, at the University of Washington, spend a year immersed in grassroots work in the community and then a year immersed in policy. That could bring about a whole new level of advocacy. And Washburn University in Kansas has integrated DNP program with a community clinic that is being constantly improved by the efforts of the students, faculty, and the patients themselves. Nursing schools and practice partners could study these examples and ask, what can we do? The report provides a few attributes of what those partnerships make them great. Things like genuine immersion in the community and opportunities for interdisciplinary practice. Next slide, please. Slide 29. There are many ways that nursing students and nurses in practice can get involved in advancing health equity, including modeling behaviors that promote a culture of diversity, equity, and inclusion, getting involved in advocacy, being aware of your own implicit biases, and taking trainings to address them, investing in your own health, and identifying and disseminating best practices to promote equitable care. Students can also seek out clinics and with organizations that are addressing the social and economic drivers of health. They can also consider getting a PhD and conducting research to build the evidence base for advancing health equity. Next slide. Nurse leaders can get involved in advocating for organizational policies and structures that support nurses and promote equity. Leaders can shape the day-to-day work of nurses, set the culture and tone of the workplace, develop and enforce policies, and serve as role models for well-being. Next slide. Getting involved, nurse researchers. Nursing research is vital to advancing health equity. The report calls on various government agencies and foundations to bring together representatives from nursing, public health, and healthcare to develop and support a robust and rigorous research agenda. This includes proposing, evaluating, and scaling evidence-based practice models to advance health equity, identifying multi-sector team approaches, reviewing and adapting evidence-based approaches to diversifying nursing schools and faculty, determining evidence-based education strategies for preparing students to eliminate structural racism and implicit biases, and improving the use of IT infrastructure to identify and integrate health and social data. The report includes a table of research topics that needs to be addressed. They're ready for everyone to look at these. They're at the back of the report. Sigma supports fantastic nursing research, and I know that some researchers are on this webinar. Researchers, please check out the list of research topics in the report and determine how you might get involved in advancing a research agenda to achieve health equity. The next decade offers tremendous challenges and opportunities for the nursing profession. More than ever, we need to tap the full potential of all nurses in every setting so that we can achieve what our country needs. for everyone, no matter who they are or where they live, to be able to experience good health and well-being. Is that too much to ask, that everyone has a fair opportunity for health and well-being? New and established leaders at all levels and in all settings are needed to lead change that results in meeting social needs, addressing the social and economic drivers of health, and achieving, ultimately, health equity. My hope is that every single one of you who are listening will answer this call, the call and the recommendations of this report, to create a world where everyone can experience the best possible health and well-being. Next slide, please. So I thank you for coming to me today, especially if you're there in the middle of the night. I so appreciate it. This report is so critically important. For those of you who don't know, the very first Future Nursing Report that was released in 2010 has remained the #1 report at the National Academy of Medicine. That's saying a lot for a Future of Nursing report at the National Academy of Medicine. But what I want you to do now, as this next report is up there now, sign on. There's a link there. Sign up for the listserv. You'll see that we have many resources that we've developed now, from webinars that go into much greater depth on payment and nurses practicing to the top of their education and training, nurse well-being, very specific strategies. We also have initiated and released 3 now in an 8-part series podcast on the report. Very interesting 30-minute podcast that you can use to listen anytime, anywhere. You can assign them to your students. And so we've disseminated 3 of those so far. We have a lot of policy briefs on this website as well. So if you need to, go to your higher ups at your organization and convince them on changes that need to be made, we have the words for you. This report is based on evidence and research, and we have, 1 or 2 page briefs with exact words that you should use in advocating for these things in this country and around the globe. So do go to that website. It's really important. And the other thing is, print off copies of this report. It's all free. We are now almost at 30,000 printed copies so far, and we are in the lead again to be the #1 report at the National Academy of Medicine, a place where so many reports are released every year. So we're really proud of that. But print it off. It's a long report, 500 pages, but you can do it in chapters, or you can print off just the recommendations in chapter 11. And the report is also now for sale. You can buy the book. I think I saw it recently for $75. I don't get any of that. That all goes to the National Academy of Medicine. And I believe if you have large orders, that they will give you a discount. So last slide, please. Thank you for attending. I think this is from my colleagues at Sigma, where they will send you an email in approximately a week that will include a link to the webinar recording and the process for completing the evaluation to obtain your certificate. And you can email them for questions and sign up again for future webinars or view previously recorded webinars at the link there as well. So now I'm going to stop. I know we have some time for Q&As. So what I want you to do first of all is this. I want you to sit back and think about everything that has been presented to you over this last 40 minutes, everything that I said, and what resonated with you most. What did you think was the most important thing that you heard? And put it in that question function. I can't see it, unfortunately, on this platform, but my colleagues at Sigma will read those to me. So what really resonated with you? What what was important? What did you hear that you really want to take action on and take note of? And if you're working on this report already, what are you taking action on, or what do you want to take action on? So I'm going to stop there and let my colleagues take over.
Yeah, Sue, I want to thank you so much for all of this great content. We have so much coming into the questions feature that I do want
Okay.
to touch on while participants are still entering. If we
Good.
want to circle back to one of your first questions that you posed to the participants about one word that described their last year. Um, some of them are not surprising. We had exhausting,
Mm.
challenging, disappointing, overwhelming. But then we had a few that, saw it in a different light as optimistic and
Mm.
hopeful. Um, One person put hope for the future, and that kind of gives me
Oh,
goosebumps.
yeah,
Um,
yeah. Me too.
Quality, all of those great things. So I think, we have a wide variety of how everyone's feeling, and I think each one of us could feel all of those at some point throughout the last year.
That's right.
So when we look at what they're putting in regards to what resonated with them, I
Yeah,
mean,
I'm really
there's
interested in that.
there's so much that you had to say. I'm sure they're struggling to articulate just one thing, but we have one person said having a nursing workforce that represents the community that they serve. I
Okay,
think
good.
mhm. Using this in the former report as a compass for the profession.
Mm.
What do you think about that, Sue?
Oh my God, I got goosebumps. I'm telling you, yes. This report is a public service. Everything that you see is all based on you know, the funding of my foundation, the Robert Wood Johnson Foundation in Princeton, New Jersey. It's all free. This report belongs to you. Take it and make it what you want of it. That's the best thing that I can say. There are a lot of recommendations. There are 9 big overarching recommendation areas in this latest report, 54 sub recommendations. And what I would say is, get some people together in your area, in your region, your network, and do an overview of that chapter 11 where the recommendations are listed, and see what resonates with you. See what you want to work on. I don't want to go through personally. I don't want to go through all of this work over the last 3 years for the report to sit on a shelf. I want to see people take action. I want to see honestly, I want to see our profession take a leading role in ensuring that everyone has a fair and just opportunity for health. So that's so important to me. If you have other recommendations to add, the recommendations you see in the report are those that were made at the time that it was, before it was released based on the evidence. There may be more evidence right now for more recommendations to be made. So take it, make it your own, bring it into your organization. For goodness sake, bring it into your organization. Assign a future of nursing committee, assign a future of nursing committee, and begin to implement some of these recommendations. So what else resonates with the report?
So there are several comments, and I'll read them in regards to inclusivity. So one individual said education and the preparation of nurse leaders and increasing diversity.
Mm-hmm.
Jackie Sharp said the need to practice cultural humility and be
Mm-hmm.
aware of internal biases.
Yeah.
And then we also have another one that uh, nursing education needs to change to focus to be more inclusive.
Mm-hmm.
Let's
Mm-hmm.
see. And we also have a few questions if you're up
Yeah.
to answering some of
Go ahead.
those.
Yep.
What have you seen done to increase diversity in nursing leadership? Is there mentorship given to them?
Yeah, so there's a lot going on. I can only speak for this country, but there's a lot going on in this country to increase diversity in leadership. My foundation, for example, has leadership programs where people can apply for these programs, and we give, precedence to people of color, disabilities, those who are underserved, for example. Many of the nursing associations, I would say many of the nursing associations, including the American Organization of Nurse Leaders and Sigma, are all doing things to help increase the leadership capacities of our nursing profession. A lot of schools are really focusing on um, what we call now holistic recruitment or holistic application process, where they are not just looking at scores. Employers, some employers, it's more rare, are bringing in nurse recruits in cohorts so that they're not the only person of color in an incoming class of new employees. So there are a lot of things. There's a lot of mentorship programs. Our campaign, if you're not familiar with my campaign, it's called the Future of Nursing Campaign for Action. So that's what you can plug into your Google search function. The Future of Nursing Campaign for Action. You can go to diversity on our website and see what we're doing with diversity. We are in partnership with historically Black colleges and universities, Hispanic serving universities, and now Native American serving universities, all with mentoring programs. So there's a lot being done. I would say we are on a really good tipping point to diversify our workforce. More needs to be done in getting, which is the point of the question, leaders into positions now as well.
So I want to pivot a little bit to a different question because we're talking, you just answered a question about mentorship and things of that nature, but what about nurses that are leaving? One question is, what recommendations do you have to deal with many of our nurses who are planning on leaving the profession due to the COVID vaccine mandate? Now, this is kind of a hot topic. So what do you think about that, Sue?
I'm not sure what they should do. The trend, I can only speak in this country, the trend in this country in order to ensure the safety of the public's health is for all providers to get vaccinated. I know on the board that I serve on, Hackensack Meridian, it's a very large health system board. I can speak personally from this position that the community and patients, and health systems are very competitive with one another. So our system in particular was hearing from patients that they didn't want to get care unless their nurses were vaccinated. They didn't want to come in. They didn't want to be cared for. So there was a lot of pressure from the community and patients for their nurses, who come into very close contact, of course, to get vaccinated. So what to do with nurses who don't choose to get vaccinated? That is a great question, and I am really not sure what to do. I believe that people should get vaccinated. That is my stance. The research plays that out tremendously. So I'm just going to leave it as that. It's a political issue, but I am sort of nonpartisan on this issue. I follow, as the report indicates, based on research and evidence. I follow the research and evidence, and the research and evidence shows that people who are vaccinated are safer.
Wonderful response. Thank you, Sue. We have a question in regards to hospital boards. So one
Mhm.
participant asked, how do you get nurses on boards at hospitals to have a voting seat?
Well, I mean, I'm on a board and I have a voting seat. Sometimes if you're the chief nurse or affiliated with the hospital, you're considered staff. You don't really have a vote that counts, but you have influence, right? Based on the work that you do in that institution. A more important question perhaps might be, how do you get nurses onto boards, period? Not just who have a vote, but period. That's really an important thing for us in this profession all over the globe. We have to have a stronger voice. We have to have more of a say in what goes on with our patients, with the people we care for, in our institutions and communities. And having a seat on a board, on a school council, on a public health advisory committee, on a health system board, but also outside of healthcare. It's really important now to have a seat on a board with those organizations that represent the social determinants, like food insecurity and transportation. So I really, really want to encourage my colleagues to do everything they can to have a voice, because that's really one of the strongest ways of leading our profession to address health equity.
Thank you for that response. We have a question in regards to recommendations for education. The question is, do you have recommendations for education and disseminating this information to nurses already practicing in the acute care setting? We know that they are
Mhm.
stressed, they're overwhelmed, they're overworked, and as we
Yeah.
learned from the responses, they're exhausted. So do you have any recommendations for that?
Yeah. I think honestly now, this report is for the future, 2020 to 2030. COVID has laid bare the stark inequities in our system. Okay, the vast majority of people, including nurses who have died, so not only people in this country, but nurses who have died, have been people of color. We know that. I follow the research and the evidence. And so, um, paying attention as I did in this presentation to one of our key chapters in this report, which is about nurse well-being. I always say nurses can't give what they don't have. Nurses cannot give from an empty cup. So we really have to, I think, first and foremost, address the nurse well-being. That's going to be ongoing, but we cannot forget the people we care for. We cannot forget them and the inequities in this system. So working with my acute care colleagues on well-being and strategies to help them, but also with the understanding that they're needed desperately to take a lead in addressing health equity.
Very good. Thank you, Sue. We have two comments in regards to systemic racism. So one person said what really resonated with them is the acknowledgement of the racism within nursing. And to coattail off of that, we have another participant that asked, how can Black nurse leaders and others actually work to their fullest when their own professional organizations are racist and do not recognize the greatness that other races have to offer?
Well, great question. And honestly, this is what this report is about. And the first thing you have to do is acknowledge. So for my Black colleagues who are nurses who really want to make a difference, read this report, look at the evidence, use the policy briefs that I told you about. It's all here. This is for the first time, in some of our spheres, this is being talked about. So use it. this is the time to use the information. Information is power, but influence is also important too. This is what I would say too. I was at a meeting the other day, and Zoom meeting. All these meetings are Zoom, and I want to be sort of careful with my words here, but there was a nurse of color who was trying to make a point, and um, the points that she was making and the tone and the raised voice that she was making, I think had the ability to tune some people out. In other words, anger and hurt and all those things. So she was coming from a place of anger and hurt and really, just really animated. And I think what we need, this is the time for everyone to have a voice. And I think it's really, really important to have a voice. People are allowed to have a voice now. In some circumstances, I understand that in some institutions, you still don't believe you have a voice. But really, get your stories out. Get your stories out about harm and hurt and the history and what has happened, and do that. But also couch it in, this is the time, and here's the evidence, and connect it to better patient care in this country. And I hope I've been clear in conveying this message to you about, how my colleagues of color, how anybody, how white nurses, how men of nursing, how any of us can convey this to leaders and decision makers in this country. Yes, we have to have a voice, but we have to couch it with important information, evidence, such as in this report.
Thank you, Sue, for that response. I would like to open it up. Do you have a closing comment or anything you would, final statements you would like to share, Sue?
Yeah, so let me leave it on a note of kindness. And what I mean by that is I acknowledge I'm learning a lot. We are all on this journey together. I will tell you that some people in this world have been on this journey forever, for decades. They have the lived experience, right? Um, uh, they were born a person of color, and they've had instances in harm, as I said before, that have influenced them. So they've been on that journey their whole life. Some other people are just coming to this journey. It is brand new material for them. And as abhorrent as that might be to some people, that's the reality. So what I'm calling upon with everyone is to understand that we're all at different places in this journey, and to come at each other, especially with the exhaustion and everything that's happening in burnout in our profession, to come at each other with kindness and understanding and tolerance. Kindness, understanding, and tolerance. Yes, have those crucial conversations. Yes, let your voice be heard, but with kindness. The anger, I'm afraid is just not going to get us to where we need to get to with everyone in this country. We need to be angry in order to take action, but we need to, again, kindness, tolerance, empathy, compassion for each other, and teach each other. Teach each other where we're coming from, and don't lead with assumptions. Don't lead with assumptions on any side. Okay? That's what I would leave the audience with.
Thank you so much, Sue, for sharing your expertise with us today. This has all been great information. Sigma is grateful that you took the time to share with this audience, and we look forward to hearing more from you in the future. We hope that you have enjoyed this webinar. As a reminder, 1 week from today, we will email you a link for the evaluation for you to obtain your continuing professional development certificate. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us today and have a wonderful day.